Well, the tricky thing about treating Lyme is nobody is the same. There is not one prescription for everyone. Everyone comes in at a different place. I've had people carried in. They were so damaged by Lyme disease that they were carried in. They hadn't slept for days. They were just a wreck. Within 3 months, they're skiing. I've had people come in with what you might consider mild or, just, symptoms. And a year later, they're still struggling to overcome something. And then as far as the stages, the acute stage, it's a very tough call, because if you go with the doxy and it's the first time you've ever been bit and you prevent, that spirochete from getting into your system, well, you can circumvent that. Does it prevent you? My question, even to myself, to everyone, is, does that prevent you from getting Lyme again? Because once you treat Lyme naturally, you don't get it again. You may get reinfected, there may be a flare-up, but it's not, oh, I got Lyme disease. Your body has already learned what to do with it, and so it's going to do that again. And you may need support. You may need to, boost up one supplement or another, but it's the same thing. So you don't get it again. You don't get the same cold again. Your body builds up antibodies to that. And so we do build antibodies to the spirochete, but it's a hard thing to do because it's a very tricky bug. In my practice, I'm a muscle tester. So everybody I test, what do I need to do to make you healthy? Yes, within that prescription is what do I need to do to maybe, bang that spirochete back so that your immune system could take over. So we have to educate the immune system. What's the DNA of that spirochete? Even though it can change itself and there's variations of it, we could basically learn that. We can learn, oh, this is how it hides itself. This is where it goes. It goes into a cyst, and it changes itself, and it tries to fool the immune system, which is why the autoimmune part shows up, because your immune system knows there's something there, but it doesn't know how to take care of it, so it's kind of swinging wildly, and there's other cells that get trapped in that matrix of your immune system going after something, hence the inflammation, hence the damage. So you got to look at that. But once you've treated the acute infection, then you start looking at the chronic infection, making sure your immune system can handle it, making sure your immune system understands it, and that can take it out when it comes out of that cyst. And then repairing the damage that your immune system has done and the spirochete has done simultaneously, inflammation, damage. So you've got to reduce that inflammation, you've got to start repairing. And then there's the maintenance phase, which is, there's things that take longer to recover. Your nervous system certainly is going to take longer to recover than muscle tissue. So you have to look at where did it show up? Did it wind up in your heart? You have to repair that heart. You got to give those tissues everything it needs to repair itself.